Modern medicine really is something to marvel at, and what we're going to discuss this morning is no exception. Welcoming in Dr. Gilman Tyler, Memorial Hospital of Tampa, and we're going to talk about robotic surgery, but more specifically, something called the Da Vinci Xi. That's a single-site robotic surgery. This is fascinating to me because we're talking about doing things that, well, you probably didn't think were possible just a couple years ago.
Robotic surgery's been around for several years, but the latest technology that we have at Memorial Hospital involves operating through one small incision that's only about an inch long.
And this is the gallbladder removal surgery you're talking about. And
Correct.
It's an inch long right around the belly button, correct?
The incision is essentially buried in the belly button, so the cosmetic result is far superior.
And that's probably what every patient wants to hear, I'm sure.
Gallbladder surgery has evolved quite a bit over all those years. Back in the early 90s, it evolved from the standard open operation to laparoscopic gallbladder removal, which was a major improvement. Laparoscopic surgery involves at least 3 or 4 incisions. And then when the robot came along, a gallbladder could be done robotically through several incisions, but lately it's been able to be advanced to the single site.
We want to mention that this is the first in the area to accomplish this.
Well, it's the first in the area to accomplish it with the latest version of the robot.
The Da Vinci Xi.
The Xi version is a much more versatile piece of equipment than the older versions of the robot, and we have the latest version there at Memorial Hospital.
What was your reaction to it when you were able to complete the surgery with just that single small incision and removing an entire gallbladder?
Well, it's superior for the patient, and the patients have done very well. They have less pain, and from a cosmetic standpoint, it's quite superior, and they seem to.
You use the word superior, and I guess that means that pretty much covers all the bases, so it's a safer surgery.
Yeah, it's as safe as the other operations, but the primary advantage of the single site is strictly cosmetic.
And we're talking about expanding more from around not just gallbladders, correct? I mean, this could be applicable for other surgeries down the road.
The FDA has approved the single-site surgery for gallbladder surgery and for pelvic GYN surgery.
This is really...
So it's going to be applicable for the GYN doctors as well.
Now, what would make somebody a candidate for this particular gallbladder surgery?
People that have gallbladder disease, that need their gallbladder out, it's not necessarily applicable for emergency gallbladders with a severely infected gallbladder, but it works quite well for most elective gallbladder surgery, which can be done under a more timely fashion and controlled fashion.
Anybody watching that might be in a situation like that, as dire as it may be, it's good to know that there is an alternative like this where you're cosmetically, at least coming out of it, looks a lot better. It's amazing what's going on, Dr. Tyler. Thanks for being with us this morning.
Sure. Thank you.
Appreciate it.
Okay.